wrapped up Brain Injury Awareness Month, and annually in Hawaii, thousands of residents seek emergency care for a traumatic brain injury or TBI. For more on the dangers of head injuries and prevention methods, we're joined now by Billie Wade and Dr. Kent Yamamoto from the Brain Injuries Association of Hawaii. Good to have you both with us.
Thank you.
This is such a serious issue, but we never really think about how head injuries can really affect us. Give us some of the statistics to start off.
So in the United States, there are about 3 million new cases of brain injury per year. And the interesting thing about that number is that that just includes ER visits, hospitalizations, and deaths. So it doesn't include people who sustain brain injuries and just go to their doctor's office, so don't even show up to the ER.
Mm-hmm.
Okay, so that number is probably, it may be double.
A lot higher than we think.
A lot higher, yeah.
Yeah, because you're never really, when you fall or when you, bump your head, you never think twice really, I think. What's the approach that we're going for here then?
Well, we want to provide as much information as we can to the general public. But back to a statistic again, because this is what's so mind-boggling for me. In the United States, they're saying that every 13 seconds, someone experiences a brain injury. Every 13 seconds, that's frightening. Every 43 seconds, a stroke. The numbers here in Hawaii are, of course, less, but then people suffer mini strokes, do they not? And those aren't reported, okay? I know that recently they've had a protocol, which is the rapid response, which is getting people as quickly as they can who've had a stroke to a hospital. They want them to go in an ambulance because apparently as soon as you get those neurals, I don't know what it is that they do, I don't know the machinery. But the point is to get it done quickly and fast so that you don't lose those neurons.
So what we're seeing is when stroke patients get to the ER, the time that they get that clot-busting medication, which greatly improves their prognosis, we're getting that time from when they get into the ER to when they get to that medication is a lot quicker now over the past several years. But the problem now is that patients aren't getting to the right hospitals.
Oh, okay,
right?
and they're driving themselves sometimes.
They're driving themselves, exactly. So they need to call the ambulance, and the paramedics can call the different hospitals and figure out which hospital is best suited for them.
And when in doubt, really just call the ambulance, right?
Yeah.
Don't kind of brush it off. So what are some prevention tips real quickly about, kind of protecting our heads? We wear helmets are kind of common sense.
Thank you.
But a lot of people don't do it.
One of the things that, and there are lots of agencies and organizations here in the state, but one of the things, again, is getting the awareness about safety tips. And so we're just concluding Brain Injury Awareness Month. We did that yesterday. The YMCA, Leeward YMCA, had a Healthy Kids Fair seminar. They had children playing different kinds of games, martial arts, because Healthy Kids also includes brain injury and brain safety awareness. So the Hawaii Brain Injury Association, we partnered with several organizations. And excuse me for having a piece of paper.
Okay, it's okay.
I want to make sure that I have their names. Real quick. We partnered with Department of Hawaii Neurotrauma Program, Leeward's Pilot Club, a group of women who helped us fit those helmets on the kids who came to get them. They were free. The Queens Medical Center Trauma Unit, Kapulani Medical Center for Women and Children, and the Hawaii Bicycle League. They actually set up a little course, with orange cones, and the kids drove around the race course. I held up a stop sign, and I was a policeman,
Well, no, all of this is very important information. We'll have more on our website because, of course, we need to protect our very precious brains. And thank you so much, guys, for coming in.
Thank you, Annalisa.
And like I said, we'll have more on our website, hawaiinewsnow.com. We're